Most clinicians treating spinal pain focus on the bones, the joints, maybe the muscles, and after months of treatment, the patient still comes back. Here's what they're missing: the fascia, a three-dimensional web of connective tissue that controls how force moves through your entire spine, and when it breaks down, no amount of manipulation fixes it. Research now shows that up to 50% of muscle force is transmitted laterally through fascial linkages, not through the tendon. That means the tissue between muscles is as important as the muscles themselves. In this video, I'm going to show you the exact soft tissue intervention framework, rooted in mechanotransduction science, that outperforms conventional rehab in both short-term recovery and one-year follow-up. Let's rewire how you think about spinal rehabilitation. I'm excited to share this clinical roadmap with you today, and there's something valuable in it for you at every step. Please enjoy it all the way to the end.
Okay, so if you've ever dealt with back pain, you know it can feel like this impossibly complex puzzle. But what if we've been missing a key piece this whole time? Well, today we're diving into a new blueprint for spinal health that is completely changing how we understand and treat back pain. We're moving way beyond simple fixes into a much more sophisticated world. Here's what we're going to cover. First, we'll get into just how intricate the spine is. Then, we'll uncover this kind of hidden network in our bodies called the fascial web. After that, we'll explore how modern therapies are really a conversation with your body. Look at the hard evidence that proves this stuff works. And finally, lay out what the new gold standard in spinal care really looks like. All right, let's jump right in. So, to even begin to understand the problem, you have to appreciate just how complex the spine is. I mean, it is not just a stack of bones, it is a living, breathing, dynamic masterpiece of engineering. Seriously, the design of the spine is a marvel. It's an incredible balancing act. It has to be unbelievably strong to hold us up, right? But it also has to be flexible enough to let us bend and twist and move. It's this dual role that makes it so amazing, but also what makes it so easy for things to go wrong. Just think about these three jobs for a second. It's your central support pillar, it protects the information superhighway of your entire nervous system, and it's the foundation for literally every move you make. So you can see why when something goes wrong here, the effects are rarely just a little local ache. They can ripple out and affect your entire life.
Now, for decades, when we talked about the spine, we mostly focus on the bones and the muscles, but it turns out the real game changer in understanding spinal pain has been uncovering this hidden network that literally connects everything.
And that brings us to this amazing stuff, fascia. It's not just some wrapping around our muscles, no. It's this seamless web of connective tissue that runs through our entire body. It's basically the biological fabric that holds us all together.
This is where the whole 3D spiderweb analogy really clicks into place. This network connects your back muscles to your leg muscles, your shoulders to your core. So you can imagine, when one part of this web gets tight or stuck, it can pull on and cause problems in areas that seem totally unrelated.
And here's the problem. When this healthy, gliding webbing goes wrong, it gets thick, it gets stiff, and it creates these painful adhesions. And because it's packed with nerve endings, it can become a huge source of pain. In fact, and get this, some research now suggests this fascial system could be the main culprit in up to 90% of non-specific low back pain. That is a staggering number.
Okay, so this brings us to the really exciting part. How do we actually fix it? See, modern soft tissue therapies aren't just about rubbing sore muscles anymore. They are so much smarter than that. It's more like they're having a sophisticated conversation with the body.
Today's therapy takes this cool dual approach. On one side, you have the mechanical effects, physically breaking up adhesions and getting tissues to glide past each other again. You can think of this as fixing the body's hardware. But just as important are the neurophysiological effects. This is where we're talking to the body's software, the nervous system, to basically turn down the pain volume and change how the brain is perceiving the threat.
So what does this conversation actually look like? Well, let's take myofascial release as an example. A therapist finds a restriction, they apply this gentle but sustained pressure, and then they just hold it. It's not about force. It's about waiting for the tissue in the nervous system to respond, to finally let go. That hold for 90 seconds or more, that's where the magic really happens. The tissue literally starts to release and lengthen under their hands.
And this really gets to the heart of the shift in thinking. This isn't about brute force, it's about precision. It's a dialogue. using targeted input to convince the nervous system that it's safe to let go of that tension and turn down those pain signals.
So the theory sounds great, right? But does it actually work better? Let's take a look at what the clinical evidence has to say about this smarter, not harder approach to healing.
This quote from a major review pretty much says it all. You can do exercise or you can do manual therapy, but when you put them together, the results are consistently better. It's not about one versus the other, it's about integration.
And the difference is just stark. Studies comparing conventional therapy to an integrated approach found a massive jump in patient recovery. As you can see, after a year, more than twice as many people in the integrated group felt recovered. The numbers really do speak for themselves. It's not even close.
So the message from all this research is crystal clear. You need both pieces. You address the tissue problems manually, and then you lock in those changes with active movement. That combination is the recipe for success.
So after we've looked at the complexity, the fascia, the techniques, and the proof, what does this all build toward? Well, it points to what we can now call a new gold standard of care.
And these are the pillars. First, care has to be personalized, not one size fits all. It absolutely must integrate manual and active therapies. It has to target both the physical tissue, the hardware, and the nervous system, the software. It needs to be guided by what's called clinical reasoning. That's the therapist's ability to connect all the dots for you. And, so importantly, it has to empower you, the patient, to be an active part of your own healing.
Ultimately, the goal today isn't just about chasing pain or fixing one little spot. It's about restoring the entire system, making it more resilient, more efficient, and just better able to handle whatever life throws at it. It's a huge shift from being reactive to being proactive.
And that leaves us with a final thought. You know, we so often look for that one magic bullet, that one pill, or that one exercise. But what if real, lasting healing isn't a single fix at all, but a holistic conversation with our bodies that addresses all the interconnected pieces of the puzzle?